When your knee aches in the morning, or your ankle feels stiff after sitting for too long, or your hip protests when you climb stairs, you probably assume the problem is in that joint. You assume something is wearing down right there, in that specific spot where you feel the discomfort. And if you have visited a doctor about this, you may have been shown an X-ray or an MRI. Perhaps you were told there is some cartilage thinning, or a bone spur, or evidence of osteoarthritis. And the conclusion, stated or implied, was that this is simply what happens as we age, that your joints are wearing out, that the damage is mechanical, inevitable, and located precisely where you feel it. I spent over 35 years in clinical medicine, primarily in cardiology and geriatric care, and I need to tell you something that may change how you understand your own body. Most joint damage after 60 does not begin in the joint itself. The pain you feel in your knee, your hip, your ankle, or your lower back is real. I am not dismissing that for a moment. But in a significant majority of cases, by the time you feel that pain, by the time imaging reveals structural changes, the actual process of deterioration began somewhere else entirely. It began silently. It began gradually. And it began in systems of your body that no one explained to you. Today, I want to explain those systems. I want to show you what we have learned in recent decades about how joints truly fail in aging bodies. And I want to give you information that may help you understand why some people maintain remarkable mobility into their 80s and 90s while others struggle with every step by 65. This is not about selling you anything. This is not about miracle solutions or quick fixes. This is about understanding your own physiology deeply enough to make informed choices about how you care for yourself. So let me begin by addressing a fundamental misunderstanding that affects nearly everyone who experiences joint problems after the age of 60. The misunderstanding about joint damage. When most people think about joints, they think mechanically. They imagine bones, cartilage, and the spaces between them. They imagine wear and tear like brake pads on a car or hinges on a door that has been opened and closed too many times. This mechanical model is not entirely wrong. Joints do experience mechanical stress. Cartilage can thin with repeated loading. Bone spurs can develop as the body attempts to stabilize an unstable joint. But this model is dangerously incomplete. Your joints are not passive mechanical structures. They are living, dynamic tissues that require constant maintenance, repair, and nourishment. Every component of your joint, from the cartilage that cushions bone surfaces, to the synovial fluid that lubricates movement, to the ligaments and tendons that provide stability, is made of cells that must be fed, oxygenated, and cleared of waste products. And here's the critical point that most people miss. This network begins failing long before you feel any pain. It begins failing before X-rays show any structural changes. It begins failing in silence, often for years or even decades, before the first symptom appears. Pain, in this context, is not an early warning system. Pain is a late alarm. By the time your knee hurts consistently, the underlying dysfunction has often been progressing for years. This is why treating joint pain at the site of pain often produces disappointing results. This is why anti-inflammatory medications provide temporary relief but do not stop the progression. This is why some people have surgery only to develop problems in adjacent joints within a few years. We have been treating the wrong location. We have been focusing on where the damage appears rather than where it begins. Why aging gets blamed incorrectly. When I explain this to patients, they often ask a reasonable question. If this is true, why has no one told me before? Why does my doctor simply say this is normal aging? I want to be careful here, because I have enormous respect for the medical profession and for the physicians who work tirelessly to help their patients. What I am about to say is not a criticism of individual doctors. It is an observation about how our healthcare system is structured and where its attention naturally gravitates. Modern medicine excels at crisis intervention. If you have a heart attack, we can save your life with remarkable technology. If you break a bone, we can set it precisely. If you develop an infection, we have antibiotics that can clear it within days. But modern medicine struggles with slow, gradual processes. It struggles with problems that develop over decades. It struggles with conditions that have multiple interacting causes rather than a single identifiable trigger. Joint degeneration is exactly this kind of problem. It unfolds slowly. It involves multiple systems. It does not respond well to single interventions like pills or surgery. It requires an understanding of nutrition, circulation, inflammation, and cellular biology that does not fit neatly into a 15-minute appointment. When physicians tell you that your joint pain is normal aging, they are not lying to you. They are giving you the best explanation available within the constraints of how they were trained and how their practice is structured. But aging is not a disease. Aging is a process that can unfold well or poorly depending on countless factors. And many of the factors that determine whether your joints age gracefully are under your influence. If you understand what they are, where joint damage actually begins. Let me now explain specifically where joint damage begins in most people over 60. I want to be detailed here because understanding these mechanisms is the foundation for understanding what you can actually do about them. The first and perhaps most important site of early damage is microcirculation. Your large blood vessels, your arteries and veins, are what most people think of when they think about circulation. But the real work of nourishing your tissues happens in the smallest vessels, the capillaries. These tiny structures, some so narrow that red blood cells must pass through single file, deliver oxygen and nutrients directly to your cells, and remove waste products. Your joint tissues depend heavily on microcirculation. Cartilage, in particular, has no direct blood supply. It receives nutrition through a process called diffusion, where nutrients move from the synovial fluid into the cartilage matrix. This synovial fluid, in turn, receives its nutrients from the capillary network in the synovial membrane that lines the joint. As we age, and particularly as we develop chronic inflammation, metabolic dysfunction, or cardiovascular risk factors, our microcirculation deteriorates. Capillaries become fewer in number. Their walls become less flexible. Blood flow to the smallest tissues diminishes. When this happens, your joint tissues begin to starve. Not dramatically, not all at once, but gradually. The cartilage receives less nutrition. The collagen that provides structure begins to weaken. The synovial fluid becomes less abundant and less viscous. This process can unfold for years without any symptoms. You will not feel your capillaries deteriorating. You will not notice reduced oxygen delivery to your knee cartilage. But the damage is accumulating, and eventually it will manifest as pain, stiffness, and structural changes visible on imaging. The second critical site is collagen synthesis. Collagen is the most abundant protein in your body. It provides structure to your skin, your blood vessels, your organs, and crucially, your joints. The cartilage, tendons, and ligaments that make up your joint structures are primarily composed of collagen. Your body constantly breaks down and rebuilds collagen. This turnover is essential for maintaining tissue integrity. Old, damaged collagen is removed and replaced with fresh, functional collagen. But this synthesis requires raw materials. It requires amino acids, particularly glycine, proline, and hydroxyproline. It requires vitamin C, which is absolutely essential for collagen formation. It requires adequate protein intake. It requires zinc and copper as cofactors, and it requires sufficient circulation to deliver these materials to the tissues that need them. After 60, several things happen that impair collagen synthesis. Protein absorption from the gut often decreases. Vitamin C levels in tissues tend to decline even when dietary intake seems adequate. Chronic inflammation diverts resources away from tissue maintenance toward immune activation, and reduced physical activity decreases the mechanical signals that stimulate collagen production. The result is a gradual shift from net collagen building to net collagen breakdown. Your joints are slowly losing structural integrity at the molecular level long before this loss becomes visible on imaging. The third site of early damage is the liver and its role in systemic inflammation. This connection surprises many people. What does the liver have to do with knee pain? The answer involves inflammation. Chronic, low-grade inflammation is one of the most destructive forces affecting aging bodies. It contributes to cardiovascular disease, cognitive decline, metabolic dysfunction, and, importantly, joint degeneration. Your liver is the primary organ responsible for clearing inflammatory byproducts from your bloodstream. It processes toxins, metabolizes hormones, and regulates countless biochemical pathways. When liver function is optimized, inflammatory load stays manageable. When liver function is compromised, even mildly, inflammation accumulates. Many factors can compromise liver function after 60. Accumulated toxin exposure over a lifetime, medications that stress hepatic pathways, poor diet quality, excess visceral fat, insufficient sleep. Chronic stress. As inflammation increases, it attacks joint tissues directly. Inflammatory cytokines, the signaling molecules that orchestrate immune responses, trigger cartilage breakdown. They inhibit cartilage repair. They increase pain sensitivity. They create a hostile environment within the joint that accelerates deterioration. This is why two people with identical X-rays can have vastly different pain levels. It is not just about the structural damage. It is about the inflammatory environment surrounding that damage. The fourth mechanism involves mineral and vitamin pathways that are frequently suboptimal in older adults. I want to discuss several specific nutrients that are often overlooked in discussions of joint health. Magnesium is required for hundreds of enzymatic reactions in the body, including many involved in tissue repair and inflammation control. Magnesium deficiency is remarkably common in older adults due to reduced absorption, medication interactions, and inadequate dietary intake. Low magnesium contributes to muscle tension, reduced circulation, increased inflammation, and impaired cellular energy production. Vitamin K, particularly vitamin K2, is essential for proper calcium metabolism. Without adequate K2, calcium can deposit in soft tissues, including blood vessel walls and joint structures, rather than being directed appropriately to bones. This contributes to both cardiovascular calcification and joint stiffness. Silica, a mineral found in certain foods, is important for collagen synthesis and connective tissue integrity. Silica levels decline with age, and this decline correlates with reduced skin elasticity, weakened blood vessels, and compromised joint structures. These are not exotic nutrients. They are basic building blocks that the body requires for maintenance and repair. When they are insufficient, the body cannot perform its normal regenerative functions, and degeneration accelerates. The fifth and final mechanism I want to discuss is nerve signaling and fascial health. Your nervous system is not merely a passive receiver of pain signals. It actively modulates how your tissues function. When nerve signaling is disrupted, whether through compression, inflammation, or metabolic dysfunction, the tissues those nerves serve do not function normally. The fascia, the connective tissue network that surrounds and connects every structure in your body, is richly innervated. It contains more sensory nerve endings than your muscles. When fascia becomes stiff, dehydrated, or adhered, it affects not only the movement of nearby joints but also the neural information flowing to and from those areas. This is why people with joint pain often experience symptoms that do not match what imaging shows. The nervous system is interpreting signals from a complex environment that includes fascia, muscles, blood vessels, and inflammation, not just the joint itself. One food that deserves special attention. I want to mention one food that often surprises people with its relevance to joint health: liver. I recognize this is not a food that appeals to everyone. Organ meats have fallen out of favor in modern Western diets. But from a nutritional standpoint, liver is extraordinarily dense in nutrients that support connective tissue health. Liver provides highly absorbable iron, which is essential for oxygen delivery to tissues. It provides vitamin A in its active, ready-to-use form. It provides B vitamins, including B12, which is critical for nervous system function and often deficient in older adults. It provides copper, which is required for collagen and elastin synthesis. Traditionally, liver was consumed regularly in many cultures. Its decline in modern diets correlates with an increase in nutrient deficiencies that contribute to degenerative conditions. If the idea of eating liver seems unappealing, there are ways to incorporate it more palatably. Liver can be mixed into ground meat dishes, where its flavor becomes less noticeable. Chicken liver pâté, made with butter and herbs, is a traditional preparation that many find enjoyable. Even small amounts, once or twice weekly, can contribute meaningfully to nutrient status. I mention liver not because it is a miracle food, but because it exemplifies a category of traditional foods that modern diets have largely abandoned, often to our detriment. Understanding the timeline of change, I want to set realistic expectations about what these dietary approaches can and cannot accomplish. If you have significant structural damage in your joints, if cartilage is substantially worn or bone spurs have developed, no food or nutrient will reverse that damage completely. Some changes are permanent, but this does not mean improvement is impossible. The symptoms you experience are not determined solely by structural damage. They are influenced by inflammation, circulation, nerve function, muscle strength, and many other factors that can improve with appropriate support. Many people with moderate structural damage live with minimal symptoms because these other factors are well managed. Many people with mild structural damage suffer significantly because these factors are poorly controlled. The goal is to optimize everything that can be optimized, to give your body the best possible conditions for function and repair, and to slow or halt the progression of damage that is still occurring. This takes time. Cellular turnover, tissue remodeling, and inflammatory regulation do not happen overnight. Meaningful changes may take weeks to months to become noticeable. Consistency matters far more than intensity. I encourage you to think in terms of months and years rather than days and weeks. The same gradual processes that created your current condition will gradually respond to improved conditions if you provide them consistently, not a collection of separate parts. Caring for your joints involves caring for your whole self. A message of possibility. As I come to the end of this discussion, I want to leave you with a message that may differ from what you have heard elsewhere. Your body is not simply breaking down. It is not merely wearing out like a machine with a fixed lifespan. It is a living, adaptive, regenerative system that responds to the conditions you provide. The stiffness, the aching, the weakness you may experience are signals. They are invitations to pay attention, to understand, and to respond. They are not sentences. They are not evidence of inevitable decline. I have seen patients in their 70s transform their mobility through consistent attention to circulation, nutrition, and movement. I have seen people who were told they needed surgery instead recover function through comprehensive lifestyle approaches. I have seen what seemed like fixed limitations become temporary inconveniences. This does not happen by magic. It happens through understanding, through patience, and through daily choices that accumulate over time. The information I have shared today is a starting point, not a complete prescription. Each person's situation is unique. Each body has its own history, its own strengths, and its own needs. What I have offered is a framework for understanding a set of principles that you can apply in your own context. If something I have said resonates with you, explore it further. If you have questions, seek answers from qualified professionals who understand these perspectives. Do not simply accept that your symptoms are inevitable consequences of aging that cannot be addressed. Your joints, your legs, your mobility, these are not guaranteed, but they are not doomed either. Much depends on what you do from this point forward. Closing reflections. I would be interested to hear from you about what resonated most in this discussion. Which of the mechanisms I described surprised you? Perhaps the role of microcirculation, or the connection between liver function and joint inflammation, or the importance of specific nutrients for collagen synthesis. What symptoms have you experienced that you assumed were simply normal aging, but now seem like they might be connected to these underlying processes? And what is one change, however small, that you are considering as a result of what you have heard today? Your experiences and insights contribute to a larger conversation. Many people watching this are in similar situations, wondering whether their limitations are truly fixed or whether improvement might be possible. Your comments may help them feel less alone and more empowered. Thank you for spending this time with me. I hope the information I have shared serves you well, and I hope it reminds you that your body, despite its challenges, remains capable of positive change when given the support it needs. Take good care of yourself, move gently, nourish wisely, and never underestimate what your body can accomplish when you work with it rather than against it.